Hello, this is Dr. Ford Brewer with state-of-the-art heart attack, stroke, and cancer prevention. Why depend on a messy and unreliable cure when you can prevent it in the first place? Today we're going to talk about niacin. It's a big topic. There's been a lot of debate about niacin over the past decade, and we'll cover a little bit of that. First of all, what is niacin? It's vitamin D3. You put it together with nicotinamide, which is a related compound, and that's the vitamin D3 structure, or the vitamin D3 complex, or B3 complex. What is it for? Well, from a historical perspective, it was found to cure and prevent pellagra. What is pellagra? Well, it's a multi-system problem. One of the key problems that you have with pellagra is a dermatitis that can become very severe. This is a picture of an individual with pellagra dermatitis. It also causes a thing called black tongue. This is a picture of black tongue, and as you can see, it's not a subtle finding with black tongue. It's there. It's obvious, and it's not something that's easy to miss. In fact, some of the first names for vitamin D3 were PP factor, pellagra prevention factor. This was originally discovered back in the late 1800s and confirmed in the early 1900s when a researcher withheld niacin in the diet of dogs until they developed black tongue, and then gave them this PP factor, nicotinamide or niacin. Now, I started to say nicotine, and here's why I started to say that. Here's how that researcher created his niacin. He took this molecule. If there are biochemists out there, some of you may recognize that as nicotine. So this is the niacin. This is common to niacin and nicotine. All he did was oxidate this and ended up with two oxygen molecules on a carbon there. So he took that ring off. In other words, right there. So this is niacin, and again, he made it from nicotine. So an interesting thought about some of the reasons why nicotine may have such an impact that it does. It messes so many things up. Speaking of being involved in a lot of processes, niacin is involved in over 450 metabolic processes. And you may recognize this is the mitochondria. So again, biochemists in the group may recognize and remember things like the TCA cycle, Krebs cycle, and oxidative phosphorylation especially, all involve NADH, NADPH. The N in there stands for nicotine, and so nicotine is a major component in many areas of our metabolism. Well, so what's the big deal about nicotine? Not nicotine. What's the big deal about niacin? It is the only medicine, prescription or otherwise, that's been shown to have all of these positive effects. It's the only thing that improves Lp(a). It's the only thing that, we have found some other things recently which do, but the only thing that raises HDL. It lowers LDL, it lowers MPO, myeloperoxidase. Remember we talked about the joker. It has multiple other positive impacts in terms of especially the topics that we talk about. Oxidation, inflammation, and cardiovascular disease, and lipids. Lipids being cholesterol and triglycerides in our blood, or fats in our blood. So there has been a lot of debate, as I mentioned earlier, over the past 10 years about niacin. It revolved around two studies. One of them was Aim High, and the other one was HPS2 Thrive. HPS2 Thrive came out first, and it was set up by Merck, I think, the maker of the medication. They put lopropriant with niacin. Those of us who took niacin back in that time period, the 2008, 2009, may remember they came up with a version of niacin that was no flush. Remember, niacin causes a flush, and it causes a flush because of prostaglandins. You remember that term? If you don't, I've got a couple of videos that mention prostaglandins. The video on aspirin and a couple of others. Prostaglandins, as you might recall, were originally named because they were discovered from the prostate gland. At that point, they thought that that was what was made by the prostate gland. Since then, they found that most tissues create prostaglandins. Prostaglandins act like hormones, but they don't course through the entire body. They just are very locally acting. So what's the thing about niacin and prostaglandins? Niacin have a prostaglandin effect. That prostaglandin effect results in vasodilation. In other words, the small arteries and capillaries dilate. When they do, and that's in the skin, you get that flushing and itching. That's what causes all that. So they discovered a chemical called lopropriant, which stopped it. It blocked the prostaglandin receptors that niacin was hitting with that flush. So you didn't have the flush anymore, and it was very comfortable. What they found out, get back to HPS2 Thrive, that was the mechanism regarding why HPS2 Thrive didn't work. You blocked that prostaglandin or prostioid receptor, and you didn't get the flush. Unfortunately, you didn't get the positive impact of the niacin either. So it does appear that a lot of the positive impacts of niacin do depend on that prostaglandin impact. I recommend, and I take niacin. What you see today is people do have very few problems with niacin. The reason is there are extended release types of niacin where you get very, very little impact. Pardon me for that spoiler, but it needed to be there. I'll just make one other comment. So after HPS, or a couple of other comments about HPS2 Thrive and Aim High. HPS2 Thrive saw that, or indicated that there was not an improvement in cardiovascular events in patients taking niacin plus lopropriant, the anti-flush agent. So guess what the press said? Niacin doesn't work. Niacin's got problems. Doctors say cholesterol drug too risky to take. That was in the Times Daily. The Boston Globe said niacin drug causes serious side effects. Of course, there are side effects with these medications, niacin included. However, like my mom used to say, they threw the baby out with the bathwater. They threw out the good with the bad. They threw out niacin, which does work, when they threw out the lopropriant. Now, that would have been easy enough for the niacin camp to overcome. And in fact, they were working on overcoming that. Then they got hit with Aim High. Aim High, the M in Aim High stands for metabolic syndrome. So this was looking specifically at that huge portion of the baby boomer population where you have what's called the lipodystrophy of diabetes. Now let's not get confused over terms. Lipo just means fat, and dystrophy means bad, like muscular dystrophy, problem. The lipodystrophy of diabetes is that you have a low HDL, which is not good, and a high triglyceride. They were looking specifically at this group. They gave them niacin. I think it might have been Niaspan, in addition to a a statin. So what they expected to see was an improvement. They did not. Now there was, again, the press came out again saying, yep, that proves it, the niacin doesn't work. Well, again, a couple of headlines about that debate. Niacin doesn't work and is harmful. In the New England Journal, the Aim High folks came out and gave their information regarding it. The bottom line was, saying that niacin didn't work was ignoring tons of other studies, meta-analyses that indicate that niacin does help. HATS, FATS study, coronary drug project, the Oxford study, several others. So I'm not going to try to prove to you that niacin works. In fact, I can't. I'm not the arbiter of reality. I can just tell you what's been going on in terms of the debate, and I can just tell you what I'm doing. I'm taking niacin, 2 grams a day. I occasionally will get a flush. It's not bad at all because I take Rugby brand extended release.